Does pregnancy cause tooth decay? Here's the thing, pregnancy does not change anything fundamental about why you get cavities or gum disease. Being pregnant isn't a direct cause of tooth decay. It is not. Why then do some women who have never had issues with cavities start to get cavities all of a sudden during or after being pregnant? The main reason would be changes in eating and drinking habits. You're growing a human life inside you. That takes a lot of energy, a lot of resources. You get cravings for foods and drinks, which are, the source of energy and resources. Carbs, sugar, acid, that's what breaks down teeth. So maybe you started getting cravings for starchy foods, sweet foods, acidic foods, and that can be harsher on your teeth. And your eating habits, you might be snacking more often throughout the day because you're getting hungry, because again, you're growing a life inside you. So there's a website I like. It's called thedentistdad.com. You can go there, print out the snack guide, and if you stick that on your fridge at home as a reminder, basically sticky carbohydrates, sugars, acidic foods, pretzels, crackers, cereal, juice, dried fruit. You want to get that stuff off your teeth quickly so that it doesn't have time to break your teeth down. You can still have these foods and drinks, but it is all about minimizing contact time with the teeth. Snacking and sipping over longer periods of time are worse for the teeth. You also want to rinse with water thoroughly after you've had any carbs, sugar, or acidic foods and drinks. Okay, what about gum disease? Does pregnancy cause gum disease? You may notice that your gums swell and or bleed more while you're pregnant. This is actually quite normal. It's not something you need to get too worried about. The best thing you can do, continue flossing at home, even if that causes your gums to bleed more. That's okay. It is a good idea to go see your dentist for regular cleanings while you're pregnant. You don't have to avoid dental offices while pregnant. Cleaning the teeth can help minimize the risk that any gum tissue inflammation gets worse for you. Your dentist can also advise you further on preventative care so that you don't have any surprise dental issues as a new mom. You're gonna have enough stuff to deal with. Let's at least get the teeth healthy, right? It's also good to be established with a dentist so that you can be getting health information about your new child as well. We want their smile to get started off on the right foot or tooth or whatever, right? Honestly, that is the key to health, is early establishing healthy habits early in life. It's unbelievable the number of health problems that will completely eliminate from someone's life if you get someone on track with very basic, simple health habits. Not just within dentistry, but within general health. But it's crazy. If you're dealing with morning sickness while pregnant, it's important to protect your teeth from stomach acid. Stomach acid is very acidic, much more acidic than many of the acids we get in our diet. So if you're dealing with gastric reflux or morning sickness, it can break your teeth down super quick, really fast. It's not great. So not everybody realizes this, but you don't want to brush your teeth right after you have a reflux episode. That acid weakens the teeth and you can erode the teeth further if you brush them right away after an acid exposure. Instead, what you want to do is rinse your mouth out right away. Rinsing with water, preferably fluoridated tap water. That's good. Even better, mix in some baking soda with the water. Baking soda is very basic and it will neutralize the acid quickly. A tablespoon of baking soda and a cup of water, mix that up, swish for about 30 seconds, spit it out, you're good to go. Another great option is to rinse right away with a fluoride-containing mouthwash for 30 seconds to a minute. Spit that out. Acid breaks teeth down, but fluoride helps repair teeth. Just spit after you're done with the fluoride mouthwash. Don't rinse with water right after that. Let that fluoride sit on the teeth for a little bit longer. Another question a lot of people have, is it safe to see a dentist while pregnant? Yes, it is perfectly safe to go see a dentist when you're pregnant. Lots of women don't know this and they avoid seeing the dentist while they're pregnant out of fear of dental procedures or dental x-rays. X-rays these days use a very minimal amount of radiation. Not enough to cause problems for you or your developing baby. If you need to have a problem looked at while pregnant, an x-ray is totally okay. If you want to postpone your standard x-rays until after you deliver, that's fine, it's probably not a big deal. But also, you can be confident that we don't have any evidence that a standard series of bite wing x-rays, the type of dental x-rays you get at a regular dental checkup, we don't have any evidence that those can cause any trouble for your baby. You actually get more radiation exposure from taking a cross-country plane ride than you do from dental x-rays. So if you're willing to get on a plane while pregnant, you really shouldn't fret about, your next dental appointment. What about when is the best time to have dental treatment when you're pregnant? Well, as long as it's not an emergency, timing any needed dental treatment for your second trimester of pregnancy, that's going to be ideal. During the third trimester, you might have a more difficult time getting comfortable in a dental chair, during a procedure. Getting numb for dental treatment is also safe. There are local anesthetics that are approved for pregnant patients. You do generally want to avoid nitrous oxide, that's laughing gas. Best not to use that while pregnant. Don't go doing whippets while pregnant. But other than that, very safe to go to the dentist while pregnant. Not really much of anything that you need to worry about. There's ways to work around and accommodate pregnancy in a dental office.